The afternoon session, we start off today with Rachel Ficklos. I'll try that again. Rachel Fishlock from Gayaa Dhuwi, which is Proud Spirit, Gayaa Dhuwi, Australia. Rachel is a proud descendant of the Yuin Nation and is the Chief Executive Officer of Gayaa Dhuwi, Proud Spirit, Australia. Previously, Rachel worked as at the National Aboriginal Community Controlled Health Organisation, NACCHO, and currently sits on the Fearless Women Board and the Capital Health Network Board. Rachel works to achieve the highest attainable standard of social and emotional well-being, mental health, and suicide prevention outcomes for Aboriginal and Torres Strait Islander peoples. Welcome to the stage, Rachel Fishlock. Thank you so much. Water if you need it, or mints, or...
Thanks. Very short. Hello everyone, afternoon. So I'd like to acknowledge the traditional owners of the lands I'm on today, the Wurundjeri people, the Kulin Nations, and pay respects to the elders past, present and emerging. I'd also like to acknowledge those who've lived a living experience of suicide. Without them sharing their stories, we wouldn't be able to write policy, develop frameworks or deliver services as we all strive towards zero suicide. So I'm Rachel Fishlock and I'm a proud descendant of the Yuin Nation and the CEO of Gayaa Dhuwi Proud Spirit Australia. So Gayaa Dhuwi was established in early 2020 as the national peak leadership body for Aboriginal and Torres Strait Islander social emotional wellbeing, mental health and suicide prevention. As a community-controlled organisation, we're governed and controlled by Aboriginal and Torres Strait Islander experts and peak bodies working in these areas to promote collective excellence in mental health care. We take our name from the Gayaa Dhuwi Declaration, which was launched in August 2015 as a companion document to the Farawada Declaration. But I'll talk shortly about the Gayaa Dhuwi Declaration. Our members are Aboriginal and Torres Strait Islander peak bodies. So we've got AIDA, so the Australian Indigenous Doctors Association, IEPA, the Australian Indigenous Psychologists Association, IHA, Indigenous Allied Health Australia, and NACCHO, the National Aboriginal Community Controlled Health Organisation. So our 4 member organisations represent nearly 300 organisations and more than 2,000 individuals who collectively provide services to some 410,000 Aboriginal and Torres Strait Islander people. Our board members are drawn from these member organisations, as well as leading experts in social emotional wellbeing, mental health and suicide prevention space. Our vision derives from the Gayaa Dhuwi Declaration. It is the highest attainable standard for social emotional wellbeing, mental health and suicide prevention outcomes for Aboriginal and Torres Strait Islander people. The vision is not just aspirational but foundational to our work. We aim to shape the mental health system in Australia to be more responsive to the needs of our communities by centring Aboriginal and Torres Strait Islander knowledge, cultures and practices. This commitment is pursued through a multifaceted approach that encompasses leadership, community connection, evidence-based influence and transformative actions. Our role as a peak body is to provide policy setting advice and undertake systemic advocacy to shape the mental health system in Australia and make it more responsive to the needs of Aboriginal and Torres Strait Islander people. We represent the interests of our members in the mental health sector and contribute to the evidence base that guides the work of the sector and identifies the needs of the community. We're a collective voice to change systems by centering Aboriginal and Torres Strait Islander knowledges, cultures and practices, as I mentioned, but across social emotional wellbeing, mental health and suicide prevention. So our work is informed by Aboriginal and Torres Strait Islander experts. We have 2 councils and 6 collaborative networks. So we've got a cultural council, a clinical council, and a children's collaborative network. So 6 collaborative networks: LGBTIQA plus SB, lived experience, stolen generations, workforce, and youth. So part of our work providing leadership in social emotional wellbeing, mental health and suicide prevention involves developing a range of resources for community and the mental health sector. Some of our existing resources include webinars, newsletters, the Good Yarn guidelines, guided meditations, videos on self-care and colouring in pages. But we have 2 webinars coming up that will be advertised over the next few weeks. So we've got Unpacking the Landscape of Aboriginal and Torres Strait Islander Social Emotional Wellbeing, Mental Health and Suicide Prevention, and Reflecting on Mental Health and Wellbeing during the Voice referendum. We're also in the progress of developing additional resources, including podcasts, a digital library, animations, an explainer video, masterclasses, and self-guided learning. So our work is guided by the Gayaa Dhuwi Declaration, which focuses on a best of both worlds approach to social-emotional wellbeing. The declaration is a call to action for Aboriginal and Torres Strait Islander leadership across all parts of the Australian mental health system to achieve the highest attainable standard of mental health and suicide prevention outcomes for Aboriginal and Torres Strait Islander people. It was developed by the National Aboriginal Torres Strait Islander Leadership and Mental Health as a companion document to the Whare Declaration. Many of you probably remember Tom Bridson, who would have spoke a few years ago. He is the chair of NATSML and used to be the CEO of Gayaa Dhuwi. So the Gayaa Dhuwi Declaration, it was launched on the 27th of August 2015, which we now recognise as Gayaa Dhuwi Day, and we're excited to celebrate its 10th anniversary in 2025. So the Declaration highlights 5 themes. Firstly, Aboriginal and Torres Strait Islander concepts of social and emotional wellbeing, mental health and healing should be recognised across all parts of the Australian mental health system and in some circumstances support specialised areas. Second, we've got Aboriginal and Torres Strait Islander concepts of social and emotional wellbeing, mental health and healing combined with clinical perspectives will make the greatest contribution to the achievements of the highest attainable standard of mental health and suicide prevention outcomes for Aboriginal and Torres Strait Islander people. Third, Aboriginal and Torres Strait Islander values-based social and emotional wellbeing and mental health outcome measures in combination with clinical outcome measures should guide the assessment of mental health and suicide prevention services and programs for Aboriginal and Torres Strait Islander people. Fourth, we've got the Aboriginal and Torres Strait Islander presence and leadership is required across all parts of the Australian mental health system for it to adapt to and be accountable to Aboriginal and Torres Strait Islander peoples for the achievement of the highest attainable standard of mental health and suicide prevention outcomes. And the fifth is Aboriginal and Torres Strait Islander leaders should be supported and valued to be visible and influenced across all parts of the Australian mental health system. So how does, the intersection between physical and mental health differ for Aboriginal and Torres Strait Islander people? So the intersection of physical and mental health is a crucial aspect of understanding and improving the overall well-being of Aboriginal and Torres Strait Islander communities. Physical health and mental health are deeply interconnected, influencing each other in significant ways. The relationship is especially important in the context of Aboriginal and Torres Strait Islander people, where social and emotional well-being encompasses a holistic view of health. For Aboriginal and Torres Strait Islander people, health is viewed through a holistic lens that integrates the physical, mental, emotional, spiritual and cultural dimension of social and emotional well-being. The 1979 National Aboriginal Health Strategy emphasised a holistic approach to health, defining it not as the absence of illness in an individual, but as the social, emotional and cultural well-being of the entire community. The definition is Aboriginal health does not mean the physical well-being of an individual, but refers to social, emotional and cultural well-being of the whole community. For Aboriginal people, this is seen in terms of the whole-of-life view. Healthcare services should strive to achieve the state where every individual is able to achieve their full potential as human beings and must bring about the total well-being of their community. So social emotional wellbeing is the Aboriginal and Torres Strait Islander paradigm, grounded in Aboriginal and Torres Strait Islander standings of wellbeing and incorporates 8 interconnected domains that contribute to an individual's holistic health. So 8 domains are connection to body, connection to mind and emotions, connection to family and kinship, connection to community, connection to spirit, ancestry and spirituality, connection to country and connection to culture. This perspective is rooted in a collectivist approach where the self is inseparable from family and community and environment. So the health disparities faced by Aboriginal and Torres Strait Islander people are stark. The life expectancy gap between Aboriginal and Torres Strait Islander people and non-Indigenous Australians remains significant despite efforts to close it. As of 2020 to 2022, the data tells us that Aboriginal and Torres Strait Islander males are expected to live 71.9 years and females 75.6 years, compared to 80.6 years for non-Indigenous males and 83.8 for non-Indigenous females. This represents a gap of 8.8 years for males and 8.1 for females. Mental health conditions are prevalent among Aboriginal and Torres Strait Islander communities, often occurring alongside chronic physical health conditions. For example, people with chronic obstructive pulmonary disease are more likely to also have a current mental health condition, which at 73%, followed by those with back problems at 61% and asthma at 57%. Additionally, psychological distress is more prevalent among those with disabilities, with 80% of individuals with a psychological disability reporting high or very high psychological distress. The intersection of physical and mental health presented unique challenges for Aboriginal and Torres Strait Islander people. which includes historical and ongoing trauma. The impact of colonisation, dispossession and systemic racism has left a legacy of trauma that affects both physical and mental health. Intergenerational trauma continues to influence the health outcomes of Aboriginal and Torres Strait Islander communities. Social determinants of health, so factors such as poverty, inadequate housing, unemployment, and limited access to education and healthcare contribute to poor health outcomes. These social determinants are closely linked to both physical and mental health conditions. Barriers to healthcare access, geographic isolation, cultural insensitivity, and systemic biases in healthcare systems hinder access to appropriate and effective healthcare services for Aboriginal and Torres Strait Islander people. These barriers exacerbate existing health disparities and hinder efforts to achieve health equity. Stigma and discrimination. Experiences of racism and discrimination within the healthcare setting can deter individuals from seeking care and negatively impact their mental health. These experiences can lead to mistrust in healthcare providers and systems. Cultural disconnect. So mainstream healthcare models often fail to incorporate Aboriginal and Torres Strait Islander cultural practices and understandings of health. This disconnect can result in services that are not culturally safe or appropriate, further alienating individuals from seeking care. Addressing these challenges requires a multifaceted approach that integrates physical and mental health care, respects cultural practices, and actively involves Aboriginal and Torres Strait Islander communities in the development and implementation of health initiatives. So to understand the role of Gayaa Dhuwi, we need to unpack the shift in the policy landscape over the last few years. The social and emotional wellbeing, mental health and suicide prevention policy landscape has changed significantly since the Gayaa Dhuwi Declaration was launched. In 2017, the 5th National Mental Health and Suicide Prevention Plan was released. This was the first time Aboriginal and Torres Strait Islander people were considered a priority population in terms of mental health and suicide prevention. Under Action 12.3 of the plan, stated governments will improve Aboriginal and Torres Strait Islander access to and experience with mental health and wellbeing services in collaboration with ARCHOs and other service providers. By recognising and promoting the importance of Aboriginal and Torres Strait Islander leadership, supporting the implementation of the Gayaa Dhuwi Declaration. The plan also committed all governments for the first time to work together to achieve integration in planning and service delivery at a regional level. It gave consumers and carers a central role in the way in which services are planned, delivered and evaluated. In 2020, the National Agreement on Closing the Gap was launched. The National Agreement was built around what Aboriginal and Torres Strait Islander people said is important to improve our lives. It includes 4 priority reforms to change the way governments work with our people, new government accountability measures and shared monitoring and implementation arrangements. It was the first time governments and Aboriginal and Torres Strait Islander peak bodies came together to share decision-making and give our people a genuine say in the design and delivery of programs, policies and services that affect us. Social emotional wellbeing was highlighted as a key priority within the National Agreement, with a social emotional wellbeing policy partnership being established with Gayaa Dhuwi as the lead peak and Professor Pat Dudgeon as co-chair. The policy partnership works to achieve outcome 14, being that Aboriginal and Torres Strait Islander people enjoy higher levels of social emotional wellbeing against a target of significant and sustained reduction in suicide of Aboriginal and Torres Strait Islander people towards zeros. In 2022, the 6th National Mental Health Plan, which became the National Mental Health and Suicide Prevention Agreement, was released. It sets out the shared intention of the Commonwealth, state and territory governments to work in partnership to improve the mental health of all Australians, reduce the rate of suicide towards zero and ensure the sustainability and enhance the services of the Australian mental health and suicide prevention system. It supports improved mental health and suicide prevention outcomes through collaborative efforts and funding for specific services in each state and territory. Specifically, under Clause 110, it commits to implementing the Gayaa Dhuwi Declaration and ensuring the work of this plan aligns with the National Agreement on Closing the Gap and the National Aboriginal and Torres Strait Islander Suicide Prevention Strategy and the National Strategic Framework for Aboriginal and Torres Strait Islander people's mental health and social emotional wellbeing. The Gayaa Dhuwi Declaration is the touchstone of our work to promote Aboriginal and Torres Strait Islander social emotional wellbeing, mental health and suicide prevention. As I mentioned, Australian governments are committed to recognising and promoting the importance of Aboriginal and Torres Strait Islander leadership and supporting implementation of the Gayaa Dhuwi Declaration. We've developed a 10 an implementation plan for the declaration, which sets out a 10-year plan for its implementation. We're the first country to develop our own declaration from the Farawada Declaration, and will hopefully be the first to see its implementation. The process was seen by an Aboriginal and Torres Strait Islander Governance Committee and a government advisory group. The consultation process included 3 rounds of workshops engaging over 500 stakeholders in inviting submissions of the draft implementation plan. The purpose of the implementation plan is to translate the aspirational picture outlined in the declaration into tangible actions, which are to be delivered by a range of stakeholders. To enable this flexible approach, the implementation plan has been structured into 3 key phrases. Phase 1, identify and develop, will involve establishing key mechanisms and partnerships to support the later phases of the framework. Phase 2, implement, will see monitoring and evaluation of key priority actions undertaken in Phase 1 and the implementation of key actions identified for Phase 2. Key actions will also be identified in Phase 3 in response to community needs and the changing policy landscape. Phase 3, finalise implementation, evaluate and future plan, will involve implementing and the remaining actions identified and undertaking a comprehensive evaluation of the declaration's implementation. This phase will involve future planning to ensure the sustained implementation of the declaration. Each of these phases will be underpinned by effective governance mechanisms. This will ensure the effective performance, monitoring, collaboration and accountability across the life of the implementation. The implementation plan has been endorsed by the Social Emotional Wellbeing Policy Partnership and the Mental Health and Suicide Prevention Senior Officials Forum, and received in principle endorsement from the Minister for Health and Aged Care, so we look forward to launching it this year. We've also had a key role in renewing the 2013 National Aboriginal and Torres Strait Islander Suicide Prevention Strategy. In 2013, the NAPSIS was developed by Aboriginal and Torres Strait Islander experts and leaders in mental health and suicide prevention, but the policy landscape has changed since then. The process for the renewal of the strategy was overseen by an Aboriginal and Torres Strait Islander Governance Committee and a steering committee. The consultation process included inviting submissions against the discussion paper, 13 roundtables with over 150 stakeholders, and inviting submissions against the draft strategy. The renewed strategy contains 6 priorities that build on evidence base in Aboriginal and Torres Strait Islander suicide prevention evaluation project. The priorities and initiatives are designed to empower, support and enable community-led responses to suicide and self-harm for Aboriginal and Torres Strait Islander people. For the strategy to deliver meaningful and sustainable outcomes, 3 enabling factors are required to enable the appropriate environment for the priorities and initiatives to be implemented and sustained. These are sustained, flexible and targeted funding, effective implementation, and governance monitoring and evaluation. The strategy is in the process of being finalised with an implementation plan to be developed. Gayaa Dhuwi is a member of the Coalition Peaks, and we're working in partnership with government under the National Agreement on Closing the Gap. As I mentioned, this sees us co-chairing the Social Emotional Wellbeing Policy Partnership with the Department of Health and Aged Care. The membership of the Policy Partnership consists of 10 Aboriginal and Torres Strait Islander members and 10 government members. The Policy Partnership aims to improve social emotional wellbeing and mental health of Aboriginal and Torres Strait Islander people and reduce suicide rates. The Policy Partnership has met 4 times since March last year, and an outcome of the Policy Partnership is the refresh of the National Strategic Framework for Aboriginal and Torres Strait Islander people's mental health and social emotional wellbeing, also known as the SUB framework, and Professor Pat Dudgeon is also the chair of that process. Gayaa Dhuwi worked in partnership with Lifeline to establish 13 Yarn. So 13 Yarn is the first national crisis support line for mob who are feeling overwhelmed or having difficulty coping. It offers confidential one-on-one yarning opportunities with a Lifeline-trained Aboriginal and Torres Strait Islander crisis supporter who can provide crisis support 24 hours a day, 7 days a week. 13 Yarn empowers our community with the opportunity to yarn without judgment and provide a culturally safe space to speak about their needs, worries or concerns. So in August 2023, we held our first face-to-face national conference. The theme was The Ways Forward, a reflection on the policy development in Aboriginal and Torres Strait Islander social emotional wellbeing, mental health and suicide prevention. It highlighted the significance of the 1995 Ways Forward report as a milestone in Australia's mental health history, marking a pivotal moment of collective action and community engagement in shaping the future of mental health care. The release of the 1995 Ways Forward report was a landmark event that brought together the voices, experiences and expertise of individuals and communities affected by mental health issues. It represented extensive consultation with mental health consumers, carers, professionals and community organisations, establishing a framework for transforming mental health care and support in Australia. It provided a roadmap for change, focusing on the principles of recovery, consumer and carer participation, community-based care and the needs for culturally responsive and inclusive services. We republished the 1995 Ways Forward report and launched it at our national conference, and it's available on our website. And we also have hard copies if anyone wants a copy of that. So Aboriginal and Torres Strait Islander presence and leadership in Australia's mental health system is vital to achieving the highest attainable standard of social emotional wellbeing, mental health and suicide prevention outcomes for our people. In 2022, the rate of death by suicide for our men was 2.6 times higher than that of non-Indigenous males, 2.5 times higher for our women. Reducing deaths by suicide and suicidal behaviour among our people and ensuring higher levels of social emotional wellbeing are issues of major concern, and this work can't wait. Full implementation of the Gayaa Dhuwi Declaration would reflect a fundamentally new way of providing mental health, social emotional wellbeing and suicide prevention services to our people. And as the Productivity Commission's report on the review of the National Agreement of Closing the Gap found, we can't keep making small tweaks to our business as usual processes. We need to make substantive and systemic change. So I guess in all of that, a way to address the physical health needs of our people is to address it through social emotional wellbeing as its holistic view of health. So thanks.